My name is Dr. Vijaykumar Singh. I am working in the Department of Community Medicine and in the position of Professor Head of the Department at Seth GS Medical College and KEM Hospital. When I was studying in school, we had only two choices, medicine or engineering. It is my father who motivated me, and it was his dream for me to become doctor. In fact, he wanted me to become join Armed Forces Medical College. I joined medicine because of my father. Later on, I realized that this is actually, I was very lucky to get this branch so that I treat suffering of people and to make tangible change in their lives. So I'm very happy I'm here in the medicine. It comes to role model. There are so many role models in my career, right from my school time. At different stages of my life or my career, role models are going on changing. There are so many shifted. So my teachers, my colleagues, my seniors, even my junior, they at times they were my role model. If it comes to personal life, I feel the best role model for me still today is my father, who actually believe in me and trust me, and because of him I am here in the medicine. So all his whatever he has taught me is coming true by coming in medicine. Madam, if you see, for a doctor, the goal of the doctor is to treat the patient and to cure the patient, and each patient is different. Doctor tries to best of his knowledge to diagnose and treat. All patients are different. They don't come, even if the complaints are same, but understanding wise they are different. Especially in this particular public hospital, if you see the load of patients. Okay. Now when we talk of health problems, it is that only the workload which causes stress, the fear of getting wrong with the patients, and this causes a lot of balance between your professional and the family life. It is very difficult, so it causes stress, it causes anxiety, it sometimes causes insomnia also. Some doctors also suffer from depression, and because the coping capacity is different. So I have even seen the suicide amongst the doctors when they don't cope up with the all stress, and especially in relation to the patient, when it comes to the doctor back. So these are the problems which doctors face, especially in public hospital. Violence is sometimes commonly encountered problem in public hospital and others hospital also, and in fact doctors try to see that all patients are cured, properly treated, but sometimes because of violence it causes a lot of disruption in the public services. Doctors, when the young students, they want to come in the medical field, when they read this news, then there is a fear. It discourages people, the individuals who are intelligent, who wants to come to medicine. It is one of the very important factor. You have to see that people see the news, and then another thing is that there is a fear amongst doctors who are practicing. Sometimes doctor, for treatment, they take certain risks, and after that taking risk, the patient gets cured. So that risk-taking thing is very difficult in such situation when there is a violence. Okay. And also I would say it affects the quality care. Because of the fear, doctors don't go in detail and proper, take certain small risks, and it affects the quality because volume of patients is more. I would say this is very important issue which we have to certainly see, but it should not happen. Now, there are two parts of this question. One, you said medical education, other is healthcare system. Now, medical education, if you see, it's already been taking place from 2017, when we have got this competency-based medical education, where besides that traditional teaching, now we are focusing on competency, like we focus on the student. It is a student-centric education now, where we teach them how to become competent doctor at the end of the course. This is about, and certainly this will lead to again the training part, which will, by which the doctors learn, the budding doctors learn the compassion, how by which they give satisfaction to the patient. Now, second part, health services. Definitely, we have a lot of health facilities which are remote, and we don't have so many expert doctors. So I would say that in coming years we will try to bridge this gap by digitalization, or you can say some AI leaded what you say is diagnostics. So this will definitely, like telemedicine is another thing which will help to to consult from remote areas. So ultimately, I want to talk about the universal health coverage, which will be there in near future. Heartfelt experience. There was one case which I clearly remember, which has impacted me, and also it has got a lot of influence on teaching to our young budding doctors. Okay, in the way that once during my post-graduation, I encountered one lady, the middle-aged lady, who came to the OPD with non-specific complaints. There were 2-3 relatives also along with her, and since she has non-specific complaints, I interacted with her, I've taken history. It was very difficult for me to do diagnosis. During the course of talking, suddenly, that times there is no power. So suddenly, power came, and the tube lights and bulbs over there, they lighted. The lady got scared because of the light. The fan was on that time, because the electricity went. So when it came back, so fan also started working. So because of the air, she got afraid because of air. And I asked them, what happened? Why she's afraid of light? And they said, no, at home also she was doing the same thing. Okay. And then after getting tired, because it's hot also, I said, you give me some water to drink. Okay. So my servant went, brought the water, and then I offered the lady, okay, you want to drink water? She got scared of water also. So it was an example, because these symptoms are seen in the case of rabies. Initial part of rabies, she was, when she was perfectly okay, she was as normal as all of us. Okay, no problem. But only I observed that she had this problem. Then because I had that much of experience during my UG days that we were taught. So I seen the patients also, 2-3 patients, but there was no complaint from the patient side, all these complaints. It was observation which led to diagnosis of rabies. Okay, so I feel it taught me that observation is very important. Doctor, when they take history, you have to observe also. And then I asked the relative, not in front of her, but I took that relative to the other room and asked whether she was bitten by dog. He said yes. The husband said yes. 5 months back she was bitten by dog. and the treatment was given. 3 injections were given, and then doctor said it's okay. It was a remote place where they were given injection. Okay, then as I thought this is rabies only because the symptoms were like that, and now it was more challenging for me to declare that she has rabies because rabies has got no treatment. It is only death in 24 hours. So how to break that sad news to the relatives at that moment when she is okay? Now she is not going to survive. It was a challenging thing, and then I could manage somehow, and I thought the communication over there, observation, besides our investigations, it is very important. So nowadays doctors, whatever we see is that they basically see the investigations. Patients are less, they see the investigation, they treat. Okay, it is not like that. You have to clinically examine and observe. Observe is the best, investigation you can do. That is taught me, and these examples I always give in front of my students. Okay, and nowadays we don't see the cases of rabies also. Okay, and in our time they used to write the referral cases we used to see in tertiary care, where history is clear, dog bite and symptoms are present. But in that particular case, there was no history of dog bite, there are no other symptoms perfect. She was having non-specific like tiredness and little breathlessness. So it was my good experience. It was very unfortunate that she could not survive, and in the night around 11 o'clock she died, and there's a lot of story behind it. I cannot tell you everything here because lack of time, but that thing taught me that we have to observe also, and same thing I advise to all doctors, observation is a very important thing in patient care for diagnosis. When you said about one word, you have to encapsulate medical practice in one word. It is very important, madam. It is like I say, we should have 3 C's. Okay, one is communication, other is care, with others is compassion. The compassion is the key word over here. If you have good communication with the patient and you want to provide quality care, you have to be compassionate with the patient. And if you see recent NMC guidelines, goals for we say Indian Medical Graduate, IMG, the roles and goals for IMG by NMC, one of them is communication with compassion. Okay, so compassion is the key word. If doctors treat the patient, talk to the patient with compassion, with empathy, okay, then definitely patient satisfaction you will get, and all problems will solve. There won't be any violence, and patient will go with smiling face and say thanks to the doctor. The compassion is a very important word. Yeah, I had some hobbies during my school time, like playing chess and indoor games, carom and all. But when I joined medicine, I started singing, okay, and also writing scripts for community awareness program. I have written scripts and I have written poems for public awareness. That is my hobby. Yeah, I actually tell them about 3 things. And 3 things in the very jolly manner. I tell them, always remember, saas bhi kabhi bahu thi. Spider-Man and hum saath saath hain. These 3 things I tell them. I'll tell you the meaning of this. When I say Spider-Man, the doctor has to remember that he is getting who is Spider-Man or Shaktiman or Powerpuff Girls. All these characters are made for the society welfare. They do welfare of the society. They have powers. They have never misused the power. Now doctors, when they become doctor, they have power by the virtue of their degree. Okay, so I tell them, you have to do the welfare, you have to work for the welfare of the society. Never do anything which is unethical. So do for society, that is, and then all children, they see all these characters. So you have to remember, even when they are in professional life as a doctor. So you see many doctors who are, maybe involved in some illegal activities. I read the news is so many. Okay, but here when I teach them, I tell them, my message is, you become Shaktiman, you become Spider-Man, and you become powerful girls for the betterment of the society, for welfare of the society. Okay, never involve yourself in unethical practices. First, what is a saas bhi kabhi bahu thi? Now, thing is that the doctors, when they are junior now. Okay, when they become senior. Okay, they get some work done by their juniors. They tell them, okay, I have also done this, you also do this. I have not slept for 3 nights. You can't even cannot sleep for 1 night. You have to also do that. You have to do emergency duties. Okay, do this, do that. Like I have done, you also do. So you have to think, whatever challenges you have faced, your juniors should be that much. Actually, you can help them out so that they should not feel overburdened. Now the era is that people, doctors have a lot of suicide cases you have seen because of overwork. So senior has to see that the juniors are safe and comfortable working with them. That is, saas bhi kabhi bahu thi is the message they have to remember. Okay, they should not behave like a saas. Other, I said, hum sath sath hai. His patient care is not an individual job. A teamwork is required. Intern, they are lowermost the ladder. The head of the department is topmost. Okay, in between there are hierarchies. So if we can't work in a team like hum sath sath hain, it is not possible. We can't just give all work to juniors. Seniors also have to do their work. Middle managers also do their work, and also interns should do their own work. They should not feel that they have to do this work alone, or they should not feel overburdened. So it is a teamwork. Everybody has its own role. Nursing staff, paramedicals, and doctors. Amongst them, there are hierarchy. So all have to do their own work. That is my 3 messages I always give. And here also, I will give this same message. Okay, everybody, all doctors should remember Shaktiman, Spider-Man for girls, saas bhi kabhi bahu thi, and lastly, hum sath sath hai. Yes, madam. I have many success stories to share in relation with the patient and also in relation with our medical students. So, we'll come to the patients. We have experienced a very odd time in 2005 when we faced the floods in Mumbai, which affected Mumbai and also suburb area. It was called as deluge of Mumbai. Okay, that time all services in slums were broken down. There was nobody there to take care. Patients were not finding any transport to come to the hospital, and in fact they were reluctant to go to the hospital because a lot of crowd was there in the hospitals, tertiary care. So that time community medicine department took lead, and we have organized so many camps in all those areas where the people were affected. Especially I'm talking about Bandra, Dharavi, and near that Mithi Nadi. Okay, Mithi Nadi. Those areas we have got Bharat Nagar near Mithi Nadi. Okay, and we coordinated with all colleges, all departments, and all doctors came together, and we used to have camps since from morning to evening, and in shift duties, shift after shift we did duty. And whenever we used to find patients who need admission, we used to treat them at home. Okay, and who needs admission, then we used to arrange transport. And now ambulance were less, ambulance fell short, so we hired the ST buses, trucks for our patients in the community. And people, they have NGOs and other agencies, they have helped us, and we could help those people in the community who were suffering from different diseases. Basically, it was like after flood, we see pandemics. So we wanted to prevent that also at the the treatment near the houses, and that was it went successfully. And I always like to share this story. There's so many things happened. I cannot tell you in detail what we faced that time. Our doctors were working since morning to evening. Other success stories, everybody knows about COVID-19. In that, we were the first to go to the airport. In a no time, we went to the after the meeting with AMC, we reached to the airport to do the screening of the passengers who are coming from abroad. Okay, and then those patients were screened, and then they were kept as a quarantine in different hotels. The hotels were converted into hospitals that time. Okay, and the treatment went, and we know that how we face this life and death, and each and every patient was important for us, and no relatives with the patient. That was the main issue, that there was no relative, no friends with the patients. Okay, only doctors were there near. Okay, and we used to communicate with their family members through telephones. Okay, and after this, time came for vaccination, and nobody was coming forward for vaccination. We created awareness, and afterwards there was a big crowd for vaccination, and we have to maintain the crowd. That also was a challenging task for us, that we that time also is gone. I can share some stories nearby the KM hospital, where we have generated a very good community participation through our elderly over there. Okay, so we have geriatric clinics over there, and regularly we help them out. Our doctors, they go in community, and we have made all arrangements in KM whenever they require any help through family adoption program. Even undergraduate students are involved in that particular program. And second, I said about students. So when I talk about success story, I cannot forget my students. Our students in KM, whenever they go to any conferences, any CMEs, when the competition debates, they get a lot of prizes, and it is because we train them, and before they go, we see how they are up to, and then we screen them, and then we send the best of best. Okay, so recently we have won the rolling trophy, national rolling trophy in Armed Forces Medical College, Pune. Okay, and it was and 25,000 prize for those students. Okay, and also we have some students went for that idea and innovation in healthcare. So one of the students got that also. So maximum prizes we have got. So I think we are in a prestigious KM Hospital and GS Medical College Institute, the Twin Institute, and I am very proud that I am associated with KM after working in Nair and Science. It is my third, and I'm working here as a HOD post, and I'm very proud of that. And our Dean Madam is always supportive. One of the very important success story which I want to share, especially with KM Hospital, that in Brazil there was malaria outbreak. Okay, and similar situation we have in India, in Mumbai. Okay, so this should not happen. So AMC sir has taken meeting and given responsibility to community medicine department to go to the different wards and see how hand-holding can be given, how mentorship can be given to MOH ward office, and see that the malaria and dengue can be controlled by spreading awareness and innovative ideas. Okay, so that challenge we have taken, and this is also I feel that is a success story of our services, which is appreciated by our deans and our AMC sir. Thank you.